One of the most interesting things of all in the study of diabetes is the fact that we know since the 30s that diabetes is a disease of improper metabolism, and also since the 30s we could measure metabolism very properly, very effectively. And yet, for some reason, we haven't been doing that much, probably because we could never do much about it. After all, why measure something that you can't do much about anyway? Well, that's all changed with the artificial pancreas treatment. And we can restore proper carbohydrate and lipid metabolism. But now I'm going to prove that to you because that's a big thing to say. Now in this first slide, you see measuring resting metabolism. There are two areas in red. The first one shows the normal diabetic range of metabolism, 0.7 to 0.8, 0.5. This is in the presence of a glucose load. But a non-diabetic person has a range of 0.89 to 1.2. These different levels of metabolism don't even overlap. The poor diabetic person isn't even on the same page as a normal. And we've known this, again, for many years. Now, what happens when we treat patients? Is it possible to restore proper metabolism? This next slide shows that, in fact, it can be done. You see, in the fuel oxidation slide, we give the patients 100 grams of glucose. And as you see on the left side in blue, normal subjects, the CHO comes up, meaning that carbohydrates are being used. And the lipids, in blue, go down. That's what happens when you give somebody glucose. The carbohydrate utilization goes up and the lipid utilization goes down, and that happens and starts in 30 to 60 minutes. You give that same 100 grams of glucose to a diabetic person and look what happens in yellow. Their carbohydrate utilization doesn't go up much at all, and the lipids stay very high. High lipids are the same as high free fatty acids, which are why people get sick, to make it easy. But you take these diabetic people who've been diabetic for 20 years or so, and you treat them for just 4 days, and look what you can get. Carbohydrate utilization goes way up and lipid utilization goes way down, just as it should with a normal person. And that's pretty exciting. What that means is it doesn't matter how long you've been diabetic. You can still get your metabolism back. Right about now you should be saying something like, yay-hoo! Or at least I'll do it for you. Yay-hoo! The next slide is equally important because you see that first slide was just glucose, and this slide is a mixed meal, a lunch if you will, with protein, fat, sugar. As you can see, the red is depictive of the diabetic people, and day 0 is before treatment. By day 2 you see they are getting better. By day 3 they're basically the same as the non-diabetic counterpart, and by day 4 they are as good as a normal person. But what about exercise, you ask? And what we did was we used an ergonomic bike, as seen on this next slide, and we compared exercising people who are normal with exercising people who are diabetic, first before and then after treatment. And you see from this slide, if you look at the left-hand side, CHO, carbohydrate oxidation, you see that the lowest level of normal people in blue is better than the highest level of diabetic people when exercising. Similarly, the lowest amount of lipid utilization of a diabetic person is higher than the highest amount of a non-diabetic. But look what happens when we treat them for just 4 days. Notice now the diabetic person is outperforming the normal, and this is what we see in our patients. We literally see the ability to exercise, which is supernormal, which is actually better than normal.